Greetings to all of you. My name is Dr. Donald Jolly Gabriel, and I have the privilege and pleasure of being the Director of Hyperbaric Medicine at the Center for New Medicine in Irvine, California. I have a PhD. I have studied hyperbaric medicine and been involved in it for 40 years, and I am so grateful the fact that I had the best hyperbaric therapists and doctors in the entire world as my mentors for over 40 years. And I want to talk about hyperbaric medicine and what it is. Hyperbaric, what does that mean? Hyperbaric, hyper means higher than normal. Baric has to do with atmospheric pressure. So when we use the word hyperbaric, we're talking about higher than normal hyperbaric pressure, pressure from the atmosphere, which we create in a mechanism called a hyperbaric chamber. Why do we do that? Well, there's a very important thing that is necessary for us to sustain our life, and it's called oxygen. It is the only thing that our body requires about every 300 seconds or we will die. Oxygen is the most important thing we utilize in our body. Obviously, after I made that statement, that's the only conclusion you can draw. And oxygen can be dosed. And the fact that anything can be dosed opens wide the opportunity of it being declared a drug by the FDA. So guess what happened? Decades ago, the FDA declared oxygen to be a drug, so it's a real drug now. You need a prescription from a physician to utilize oxygen. Why is that? Well, one of the most basic reasons that it was chosen to be a drug is because it can be dosed. Now, I'm not sure whether or not any government agency just wanted to control it or whether it was because it is a dosable substance. But it's dosable, and in high enough doses, it can do what I consider to be magic. Hyperbaric therapy is a therapy that applies oxygen at higher than normal pressure and can concentrate the level of oxygen that's utilized in the treatment of any problem. And when I say concentrate, I mean we can make oxygen pressure go up to about 3 atmospheres and cause massive amounts of oxygen to dissolve in the blood. And since oxygen is the most important element necessary for all healing, what happens is we're dosing more of the healing substance into the body. And what does it do? Well, it accelerates all healing, every kind of healing. As a matter of fact, it's a known fact now, and many doctors say to surgery patients or plastic surgery, cosmetic surgery, as they call it, or any other procedures, that if you want to heal it faster, do some hyperbaric oxygen therapy treatments, a couple before and 4 or 5 after, and your healing levels will be much faster. And really, the quality of healing is better. And when I say the quality of healing, I mean, for example, if a woman has plastic surgery and her doctor tells her, well, you know what, this is a big case, you're probably going to have to be out of circulation and away from the world so you don't scare too many people for about 4 to 6 weeks. We can say to you with great confidence that if you do hyperbaric therapy according to our protocol, after your procedure, we can have you back in the world looking quite nice at about half the time. So it accelerates healing, it increases the quality of healing, and it is a magnificent therapy. I have some questions that were asked me today, and I wanted to address a couple of them. And one of them had to do with, why do NFL players use hyperbaric oxygen? And this individual said to me, I know several that have bought oxygen chambers and they're in their house or in their garage. Why do they do that? The reason they do that is any kind of healing that's necessary for the body can be accelerated by using hyperbarics, because hyperbarics is going to increase the capability of the body to heal by forcing massive amounts of oxygen into the body. And for the NFL players, it's not just a matter of wanting to get back in the game, it's a matter of a lot of money. Because if they're told to be on the bench for 4 weeks because of their injury, that means they can't play for 4 weeks. If they do hyperbarics with a normal injury properly according to the protocol, we can generally have them back in the game in about half the time. So if they're going to lose $200,000, instead of losing $200,000, they lose $100,000. So that has to do with the question that I was asked about the NFL players. Another question I had was, my cousin had a stroke, and his wife forced him to have hyperbarics. So why? Why? Because hyperbaric oxygen therapy does accelerate healing, all kinds of healing. Specifically, it is very efficient in dealing with brain issues. And it was discovered many years ago. Dr. Richard Neubauer, who was one of my great mentors, used to always demand that any of his patients who had a stroke got in the chamber almost immediately. And you know what? They had hardly any side effects. When he got them in the chamber immediately, it was pretty magic. So that was one of the questions. Another question I had today was, what about autism? And he mentioned to me a particular doctor who had reason to treat many, many people, was treating all of them with hyperbarics as well as their normal treatment, because hyperbarics accelerates the effectiveness of all the other things they're doing, all the other treatments that they're doing. And it creates a level of healing in the autistic child that really makes it much more efficient, a little faster, and the quality is much, much better. And another question that I had from the group was, we went to Russia and we took a tour of a hospital that's all hyperbarics. And I knew about that hospital because I've been there. But I asked the person, I said, well, what did you think about that hospital? And the wife said to me, oh my goodness, I couldn't believe it. It had operating rooms and birthing rooms and all kinds of places, and some of the hyperbaric chamber rooms were big enough to hold 30 and 40 people. And she said they even had what's called a birthing room. And I, of course, knew what that was, but I said, well, what is a birthing room? Well, it's a room that anybody who is suspected of having a possibility of this particular disease, that is oxygen deprivation at birth, then what happens is they put them in the chamber, and since the birth takes place in the chamber, there will never be a problem with cerebral palsy, and there never has been, because you can't have oxygen deficiency if you're born in a hyperbaric chamber. And the hyperbaric chamber is, of course, a surgical room that's made of very, very thick steel, and the doctors are all in there with the patients, and it's like being in a room, and it is a room, but it's a hyperbaric chamber room. And never have they ever had any problem with oxygen deprivation that has created the disease process in a child. And the hospital is a magnificent place. Dr. Ruffini was running the hospital when I was there, and he had come recently to California to speak at a hyperbaric convention, and still nobody has ever given birth with oxygen deprivation. And they have rooms for everything. They have surgical rooms, they have plastic surgery rooms, they have all kinds of recovery rooms. They have a big chamber that holds 30 people. 30 people. It's like a little bus, but it's a hyperbaric chamber with about 2 inches thick steel walls. And then somebody asked me about, well, I heard in Italy that if a person has a stroke, the doctor's obligated to offer hyperbaric oxygen therapy, or at least recommend that they seek treatment. And I said, well, that's true. There is a mandate that hyperbaric should be looked at as a possible treatment for hyperbaric therapy, and that's not necessarily true in all of Europe, but it is true in some parts of Europe and also other countries. Hyperbarics is utilized in almost every country in the world, and it is a magnificent therapy. Another question that I had is, why do some people do hyperbaric therapy, a couple of treatments before surgery and a couple of treatments after? Well, it's all about healing. It's all about healing, because it creates a scenario where the person is set up for the surgery and pre-healing things begin to take place. And then after the surgery and the body is adjusting to it, the healing cascade is really sped up masterfully by hyperbaric oxygen therapy. As I said before, usually about half the time of healing. So this is the story about hyperbarics in terms of the questions that I had today. and I wanted to cover something about brain injury.